Hi, dear students. In this video, we are bringing some amazing questions for you so that we can learn how to smart guess and eliminate options. And this is a very critical part of your NEET MDS preparation, something that you must watch. Watch the video till the end, and we will run you through the entire process of how you should train your mind when it comes to option elimination. My name is Dr. Amir Godil,
Hello students, I'm Dr. Sahil from Team Meriters.
and we will be helping you understand option elimination, smart strategies, and smart guessing.
Yes.
So let's start with the questions, Dr. Sahil. We'll be looking at four questions, and
Okay.
at each question, we'll try to analyze the question, eliminate options in a very strategic way. And we are going to look at it. We'll look at very basic questions first of all. No high end, nothing surprise, no surprises. Very basic from Pharmac, from DH, DMS. We'll just look at some basic questions. Okay. Right. So the first question here is, which one of the following is penicillinase-resistant penicillin? And the options are amoxicillin, cloxacillin, ampicillin, and penicillin G. So
Yes.
what would be your strategy, Dr. Sahil?
Yes. So now see, let's say you have not read anything about penicillins. You just have a brief introduction, but you have not gone into depth about which is a penicillinase resistant. Let's say you are confused in this particular question. Now, how we will approach this is, so if we read the question, first thing is we have to read the question and all the four options carefully. So in this, we are being asked that which of these is a penicillinase resistant penicillin, which means they are asking a particular type of drug under the class of penicillins. For this, we need to know the classification of the penicillins. Now, when we go to the classification, there are three types of penicillins: the natural, semi-synthetic, and the synthetic ones. When we speak of the natural one, so in this there is only one, that is the penicillin G, which is the most basic penicillin, and the only one which is natural, also called as benzyl penicillin. Now, how to remember this is there is one mnemonic for this. We all know that nature is green, so natural penicillin G. That is how we derive. So from green we can get G. So penicillin G is the one which is the natural one. Now, in other than this, we have semi-synthetics. In semi-synthetics, again, we have a further sub-classification as acid-resistant penicillins, the ampicillin, this amino derivatives, under which we will have ampicillin, amoxicillin, and bacampicillin. And then we have the penicillinase-resistant penicillins, where we will have cloxacillin, dicloxacillin, and all those. So now if we have to do a smart guessing or an option elimination in this type of a question, let's say. Now the strategy we will follow is, see, first of all, we have to know that they are asking, so in this only one option will be correct. It is not like we can have multiple correct options in this. So now, as if even if we have read a little about penicillins or a little about pharmacology, we will know that ampicillin, amoxicillin are in the same class. And even if we do not know, we can make a wild guess, as in both are starting with AM, amox, amoxicillin, again from AM, and then ampicillin also. So the amino derivatives always start with AM, whether it is back ampicillin, ampicillin, or amoxicillin, which means that both, since both are starting from AM, it's a high possibility that both will be from the same group. Now, if two things are from the same group, then if both cannot be penicillinase resistant, because
Right.
only one option will be correct. We will have only one correct answer. So we can rule out these two, ampicillin and amoxicillin, as they are from a similar group.
Hmm.
Now we are left with the two, penicillin G and cloxacillin. Now let's say you are not familiar with the mnemonic or the classification, that penicillin G is the natural form. Even then, if you see, if something is a penicillinase resistant, like it's a very extreme version, they are asking. Penicillin G sounds like a very basic name. That penicillin G. And it's like an initial, you can say, penicillin G. Maybe because based on the author who gave it or something like that.
Hmm.
But if you see cloxacillin is something which seems very different, something new. So there are there's a high likelihood that cloxacillin might be the correct answer in this question as opposed to penicillin G.
Right. So the way I understand this is if it is penicillinase resistant penicillin, it cannot be penicillin G because penicillin G would not be penicillinase resistant. So you eliminate penicillin G. Then ampicillin and amoxicillin are from the similar groups because we always study that they are like go hand in hand. So even if we don't know their amino derivatives or if we don't know the classification, just because they belong to the same group or same class of drugs, both of them cannot be the right answer. So you can eliminate
Yes.
those, and that leaves you with cloxacillin, which would be the right answer. And that is how we come to the conclusion. And actually, the correct answer is cloxacillin. So if
Yes.
you try to analyze the question, read the question correctly, look at the options thoroughly. And if you have some basic knowledge, then it is very easy to attempt even questions like this, where it is very factual, but you could still guess and come to a
Yes.
conclusion. Right. Very well. Thoroughly explained. Very well done, Dr. Sahil.
Yes.
Let's look at the next question. A child has mid crown fracture. Okay. And in a permanent maxillary central incisor several months ago. Pulp is now necrotic. Radiographic examination reveals an incompletely formed root with an open apex. The treatment of choice. Okay. And the options are formocresol pulpotomy, root canal therapy, calcium hydroxide pulpotomy, and apexification. But before we go ahead, Dr. Sai, let me just highlight a few important keywords. So,
Yes.
child, the age is not mentioned. Mid crown root fracture, permanent maxillary central incisor, okay, with an open apex, and then incompletely formed root. The pulp is necrotic, and the history is months ago.
Okay. Yes. So now how to approach this type of question is, see, it is a very conceptual based question. So
Mhm,
in such type of questions, the first thing is to look for the keywords, as you have rightly underlined. See, if we see, first of all, it is a child patient with a
mm,
mid crown fracture. That is there is a history of trauma. So now, first thing what they should have given is the age of the patient. But since they have not given age, they have mentioned another very important clue in the radiographic examination. That is, it is an incompletely formed root with an open apex. So now, since it is an open apex, so we know that the trauma would have occurred before the complete root development had occurred, which
mm,
is around, like, let's say he could be 8 or 9 years old, he or she.
mm,
Now it is a maxillary central incisor and the pulp is necrotic. Now, very important one word is there in this question. That is, when did the trauma occur? Several months
mm,
ago. Now, why this is important is because we know there in a traumatic dental injury, there is a history of stunned pulp, where the pulp
mm,
will not give any response for 6 to 8 weeks after trauma, but it
mm,
doesn't make it negative.
mm,
So it is like a false negative response would be there for the first 6 to 8 weeks. Now, since they have mentioned several months ago, this means that the tooth in question is totally necrotic. So
mhm.
it is not at all vital. Now let's focus on the options.
Okay.
So the first option is formocresol pulpotomy. Now, pulpotomy, as we know, is a vital pulp therapy treatment. So a treatment modality which is performed only in vital pulps cannot be performed in a necrotic or a non-vital pulp. So
Mm,
that is why we will rule out the formocresol pulpotomy.
okay.
Similarly, if you see option number 3, again it is a type of pulpotomy where calcium hydroxide is the material used for pulpotomy instead of formocresol. So again, same, it is used for vital pulp therapy. Again, this will also be ruled out. Now, option 2 and 4, both are performed, that is root canal therapy and apexification. Both are performed for necrotic cases.
Mm,
Now, if we see how to arrive at the correct answer from these two is, we will see the next keyword, that is an open apex. Now, since it is an open apex, which means that there is no apical stop to do a normal obturation, which is done in root canal therapy. So that is how we will rule out root canal therapy also, because it's an open apex, and we know that in a open apex cases, we prefer procedures like revascularization, apexification, apical barrier technique, etc. So the correct answer in this question will be apexification. Two
excellent.
keywords,
Okay.
one was necrotic and second was open apex. Yes. So the next question is dimensional stability of elastomeric impression material can be given in the descending order as we have four options and we have
Mhm.
to arrange the following in the descending order of their dimensional stability.
Right. So the way I look at this question is, first of all, elastomeric impression materials very commonly asked in the exam. So in any shape and form, they are always asked. You should always read high yield topics. This is something that is very basic and is expected that you would know. Now, in case if you have not read properties of these materials in detail, you know that there are four elastomeric impression materials commonly used, and you can see that they are the options here: polysulfide, polyether, C silicon, and A silicon. Now, the question is to arrange them in the correct order of dimensional stability in the descending order. Now, don't get confused with grammatical uh, vocabulary type of terminologies. Descending means from highest to lowest in the decreasing order of the stability. That means you start with the most dimensionally stable and then you come to the least dimensionally stable. Now, when we talk of silicones, we have additional silicon and you have condensation silicon, and then you have polysulfide, and then you have polyether. Now, even if you've read a little bit of chemistry in your 11th and 12th standard, polymerization reactions, addition silicon is where monomers come together without any byproduct. Condensation silicon is monomers come together to form a polymer and leave a byproduct, condense together to leave something like water and alcohol. Whenever there is a byproduct, there is always some kind of loss of stability of the material. So, just going by the basics of chemistry from high school, you should be able to guess that C silicon is something that does not have very good stability, right?
Correct.
Now, if you have read a little bit more, you would know that polyether is one of the most preferred materials for implants, for crown and bridge, full mouth rehabs. Even A silicon is very dimensionally stable, is used for more accurate impressions, can be repeatedly poured, can be used again and again, like for pouring and generating cast, and there is complete accuracy of these materials. So only if they are dimensionally stable can you re-pour them so many times, right? So these two would be very stable materials that leaves
Stable.
polysulfide somewhere in between. Now, the way I would look at these options is to identify if I find the most stable or the least stable. So let's say, so polyether and acsilicon are the most stable. Some textbooks say addition silicon is more stable. Some textbooks say polyether is more stable. There are combination of these two materials also which are very stable. So here it is very difficult to filter out the options. The second way of eliminating an option would be to see the least stable material. So here A silicon is the least. No, this cannot be correct because it is actually a very stable material. This option cannot be correct because this is again A silicon. That leaves us with C silicon and polyether. Polyether is also very stable. It can be repoured. So that leaves us with this option. Now let's read all the options again so that we are not making a mistake. A
Correct.
silicon, very stable, yes. So this can be one. Polyether, very stable, yes. Polysulfide, somewhere in between, so three, and C silicon, four. So this is the correct option. Now, just to be sure, I'm also going to read the other options because I don't want to make a mistake, right? So
Yes.
polysulfide is not the most stable, and C silicon is not more stable than A silicon. So this is definitely incorrect. Okay. Polyether, yes, okay. C silicon is more stable than A silicon. No, that's not correct. So again, I can eliminate this option. Then the last option is A silicon, C silicon, and then polyether is the least stable in this option. So again, that is not correct. So even if you have found in these questions, even if you have found the correct sequence, correct order, make sure that you are just reading the other options to be sure that you are not making any mistake.
Yes. Correct.
Okay.
Perfect.
So I think these kind of questions can be tackled very strategically. No need to worry about if you start reading too many options again and again, it is very confusing. Okay. So be very careful in these kind of questions. Right. And the last question here, more of a factual, but somewhere you can apply a little knowledge. So we've used this question here because people get confused between the stages of tooth development. So Hutchinson's incisors result due to abnormality in, and the options are initiation, morphodifferentiation, apposition, and calcification. Okay, now how do we tackle this?
Yes. So if we see this question, first we need to know what is a Hutchinson's incisor. It
Mhm.
is an abnormality which is a abnormally shaped incisors seen in the congenital syphilis disease. Now we read the options. So if we see the abnormalities which occur in the different stages of tooth development are classified as initiation, morphodifferentiation, histodifferentiation, apposition, eruption, errors in eruption, or calcification. Now let's focus one by one. If it is a now what when we say Hutchinson's incisor, it is an abnormal shaped incisor. So there is a disturbance in the shape of the particular incisor. Now, initiation is something wherein the number will be either increased or decreased. Something like a anodontia, where there is no teeth in the dentition, or a supernumerary teeth, where there is an excessive number of teeth. These will come under initiation. When it comes to histodifferentiation, something which has got to do with the internal properties of the enamel and dentin, like amelogenesis imperfecta or a dentinogenesis imperfecta, these will fall under the histodifferentiation category. Then if we see the third option, that is apposition, things like enamel hypoplasia and all will fall under this category. And if we see the calcification part, so we can see again hypoplasia, fluorosis, these type of things will be under the calcification category. However, if we see the morphodifferentiation, we know, if someone has read basic English also, they know that morphology means the size and shape of any object. So morphodifferentiation is got something to do with a difference in the size or the shape. When I say size, it is like a microdontia or a macrodontia. And when it comes to shape, it's like a peg lateral, or in this case as a Hutchinson's incisor. These kind of abnormalities in the size and shape are seen in the due to abnormality in the morphodifferentiation stage of tooth development. So with this, we can rule out the option number one, initiation, as it has got to do with the number. The apposition and calcification both are got to do something with the calcification, hypoplasia, fluorosis. And the morphodifferentiation would be the correct answer, as it is a abnormal shape in this case. Or if it would
Perfect.
have been size also.
Perfect, perfect. Very well explained. Anyone who has a doubt on this, I think you need more reading. So please make sure that you are not leaving all the basic topics, because they lay the foundation for option elimination and strategic attempts. So in this kind of question where you have very confusing options, even if you have a little understanding, if you've read the explanation for even amelogenesis imperfecta, or if you've read for fluorosis, you will know which kind of anomaly belongs where. So reading explanations is very important because it helps you eliminate the other options. And whenever you are practicing MCQs, make sure that you also look at the other options as possible questions, so that you are covering the subject in an entirety. Don't be in a rush to just take one answer, move on to the next question, and forget about it. That is absolutely not going to help you. So make sure that you're thoroughly reading all the options in detail in terms of the explanation. Right. So with that, Dr. Sahil, do you have anything to add when it comes to these strategies?
Yes, so in this, what we have done is we have selected four particular questions which are all different. We have selected one sequence based, one the
Mm-hmm.
pharmacology was the more factual one. This
Mm-hmm.
the Hutchinson's incisor is particularly a question wherein even if you do not know what is it, with the name itself you can say that okay, something to got to do with a different shape or a size of incisor, and then you can rule out the options like I told. And the pediatric question was a more conceptual based,
Mm-hmm.
wherein you have to look for the keywords. So that is how we have covered all the things. I think one more we can do in another video, match the following and all.
Yes. Perfect. So we'll
Only
take
that
more of
part is
these
left. Yeah.
questions. We'll look at more such questions so that we can develop more strategies to eliminate options. And I think our students will find these videos helpful. If you like our content, make sure that you are liking this video, subscribe on our YouTube channel to get daily updates. And if you want to know more about Meriters, just download the app. give it a try. It's free of cost. You can access most of the features as a subscriber. And if you need more information, you can contact our customer care. And for more updates, you can follow us on Instagram. You can join our Telegram session groups for Q&A solving and for group discussions. And we wish you all the very best and take care.
All the best.